Who doesn't love the extras in life? You know, those fringe benefits when all the important stuff is taken care of. So things like extra blanket on the airplane, extra slice of cheese at the deli, or that weird head massaging machine that barbers used to have back in the day. It's like, well, it's the same for Medicare. There are extra benefits that you can get above and beyond what original Medicare offers, and here are 5 you should be looking out for in 2025. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is the best Medicare option for them this AEP, or really all year round, give us a call at the information down below, and we can help to make those tough Medicare choices. All right, so yes, there are extra benefits on Medicare, and usually they are pretty cool, but they are not directly through original Medicare. This is Medicare Part A and Part B, that's original Medicare. In fact, the predominance of the extra benefits come from enrolling in something like a Medicare Advantage plan, which is a private health insurance plan specifically designed for Medicare beneficiaries that will include extra stuff not covered by original Medicare or Medicare supplements for that matter. And it is an important but, these extra benefits that are very enticing should always be second to the 3 pillars of one's Medicare plan, which is the doctors, the prescriptions, and the health care budget. Make sure those are met first, and not just which plan has the best extra benefits. Now, that being said, here are 5 of the most popular extra benefits in 2025. First, and by far, leaps and bounds, the most popular extra benefit on Medicare, like miles and miles and miles, is the Part B reimbursement. That is essentially the Medicare Advantage plan reimburses enrollees for the cost they are paying for their Medicare Part B. What that means in practice is that they are freeing up between $100 to maybe $150, $170 worth of cash in their monthly budgets because they are covering some or most of the cost for that Medicare Part B premium through the reimbursement. These are only available on Medicare Advantage plans, and not sure really about the rest of California, but they are super duper very popular here in Southern California. Now, just a quick reminder, original Medicare Part A doesn't generally have a monthly premium. For most folks, it is free. But Medicare Part B, it does have a cost, and it goes up every single year. So getting a plan that has the high Part B reimbursement is a very, very enticing option for beneficiaries. But then again, it should only be considered if one's doctor's medications and Medicare goals are going to be served by that plan. But that extra, I don't know, $1,000 a year worth of reimbursement doesn't hurt either. 2 really enticing extra benefits that are probably low-key, some of the most useful extra benefits that come with a Medicare Advantage plan, ideal for folks who have either ears or teeth, which is probably most of us, and that isn't necessarily everybody though, but hearing and dental coverage. This is a big part of a Medicare beneficiary's life, especially if they need it, because neither hearing aids nor dental care are really covered. Sure, in the case of something major, like a major medical event that requires medical care, those things are going to be covered, but for things like hearing apparati, dental bridges, crowns, or even routine cleanings, these things are not seen as really necessary, at least back in the day when Medicare was invented, and so they are not included, but they can be included on a Medicare Advantage plan. Of course, the coverage is not all created equal since it doesn't have to be within the Medicare framework. So some plans may have lower copays, wider dental networks, or even limits on how often someone could get new hearing aids and go in for fittings. But realistically, teeth and ears can be extraordinarily expensive where there isn't any coverage cost sharing under Medicare, which makes the extra benefits for them very, very helpful on a day-to-day basis for the folks who need them. One really interesting extra benefit that has 2 ways that it can be had is through a Medicare Advantage plan, and specifically a Medicare Advantage plan designed for someone with specific illnesses like diabetes or heart disease and other kind of specific diseases, can provide benefits to include food and groceries. Now, the first way this one is done is for those folks who are getting out of the hospital for a major surgery where maybe they are not able to cook or prepare food for themselves. And in these cases, there are limited numbers of weeks that a service can be provided that brings food to the Medicare beneficiary's house to help them transition back into preparing food for themselves. The second situation falls under a food is medicine kind of perspective, and these plans especially are for specific needs plans, can provide a monthly budget or on like a prepaid card and can be used for over-the-counter benefits for healthy foods to help ensure beneficiaries are able to afford healthy foods like fresh veggies and fruits that can be very expensive if you're just paying it out of pocket. A little known and even littler used extra benefit, which is so useful, I think, especially when ants start finding those extra crumbs that you drop on the kitchen floor. And I know I drop a lot of crumbs on the kitchen floor, is pest control. And it is intuitive to think that pests like ants and rodentia and lizards, I mean, in Florida maybe, these types of pests are probably not the best for someone's health. And as folks get older, they can even lead to much more debilitating health situations, especially if there are additional factors like chronic bronchitis or breathing issues or the like. So either way, pests are not good, obviously, and the way that some plans will include pest control benefits on their Medicare Advantage plans are going to be for specific situations. What this will entail will vary pretty wildly, but usually it would include things like traps, spraying, and rodent prevention steps once or even quarterly throughout the year. I think recently, and definitely with all you folks out there on the interweb, there really has been intense interest in this next extra benefit. I guess for obvious reasons, which is a free pet services that are available to folks on Medicare Advantage plans. I mean, who doesn't love that little floof ball that is running around? And these additional benefits are ideal for someone who may need a little extra assistance moving around, or could be in a situation where they are out of the house occasionally for health reasons. Think surgeries or other types of care. These pet benefits usually consist of things like paying for a number of boarding days for one's pets, not unlimited because that would be adoption. Additionally, it will cover a certain number of walks, usually between 7 and 21 walks per year. So it won't take over all the unfun parts of having a pet, but it can be a very valuable resource for when someone needs it or in urgent circumstances. So that's going to be the 5 Medicare extra benefits that I think folks should be on the lookout for this AEP in 2025. That is the Part B reimbursement. Man, that one is such a big deal. But also dental and hearing benefits, free groceries, pest control, and pet services are all going to be super helpful, of course. And may I reiterate, specifically in this case, that the basics of Medicare must be met for the plan. That is doctors, prescriptions, and healthcare goals before these extra benefits should even factor into your decision. Check all those boxes first, and then look at the extra benefits. That's it for today for Michael's Medicare, and really I hope you enjoyed this video. And if you or somebody you know is trying to work through some of those tough Medicare quandaries, please feel free to reach out to us at the information down below, or leave a comment, or just like and subscribe, and you can get notified when our newest Medicare content comes out on the socials, on Instagram, on YouTube, because we have new Medicare content coming out every single week. So for Michael's Medicare, I'm Michael, hoping you have a great rest of your day, and goodbye.